Again. My name's Alex Ford at the Bay Area Council. This is going to be the second, everybody, welcome if you're just dialing in. This will be the second in what is kind of becoming a series of conversations we're having on what's going on in China, kind of the bounce back of the economy there, the policies that are being put into place to help the economy rebound. And basically all things related to the COVID response. If you were joined us last time, 1 week ago for our conversation, then we talked a little bit about the rebound of the Chinese economy compared to where it typically is over the course of Chinese New Year. Got a little more granular and went over a report with the folks over at GTCom. We ended that conversation by kind of saying we would really like to dive into some of the policies that are being put into place regionally and kind of see some specific examples of how those are affecting the economy. We are going to do that a little bit today. We have our friend, council member Kevin Xu at Meibao. We're going to chat with him about what his company's been doing as people have started to come back to work. And then we're also going to take a really different topic and get into a little bit about what a project out of University of Chicago that could help us all in our work to address this crisis. If you have questions, we're going to do this the same way we did last time. Just go ahead in the text box on Zoom. If you could just write those questions in, my colleague Karina Salamatina is going to help let me know when those questions are come through. If you see a question that you think is good, you'd like to see that answered, just copy, paste it, add +1.
No,
remind everybody if you could just put your phones on mute. Really appreciate it. And last, we're going to do our best this time to really stay on time. Keep it to 30 minutes and no longer. We'll save some time at the end, again, for questions if people are really interested. But the goal here is to just get some interesting information to everybody, give a little bit of an update to you, and not take up the whole day. So with that said, why don't we just jump into this? Kevin, are you on?
Yes.
Awesome. So by way of introduction, this is Kevin Xu. Kevin is the chairman of the Meibao Corporation. They have about 1,000 employees spread across their primary offices, Beijing, Shanghai, and here in California. Kevin's been a member of the council for quite some time. He's been supporting our work in Beijing, especially working on the California Trade Office. So Kevin, I think let's start with the most basic thing that we can cover. I mean, are people at Meibao getting back to work?
I would say currently we have about 90% of the workers actually get back to their office. But in the meantime, I think we are also in this phase of transitions over the last couple of months when people are like self-quarantine and how they can actually transit their kind of like working method back into the the traditional kind of form.
Yeah, are you seeing people are people happy to be back to work? Are they?
I would say actually, people actually are having this kind of demand to have a face-to-face conversation, especially because we actually have two kind of a working kind of a format, which like we have kind of like a commanding center that based in Beijing and Shanghai. So therefore, those people on different departments, they need to actually have a kind of a personal confrontation regarding to a communication for the next step of work. But in the meantime, I think it's also a better way to actually, I would say, resilient back from this kind of a crisis over a couple months ago.
Yeah, no, that's encouraging that people are kind of like excited to get back to work, to be out of their houses. I imagine it was not an easy transition for a lot of people. You said 90% of the workforce is basically back in the office?
Yes.
Is it? I mean, Meibao is a pharmaceutical corporation. Are you guys experiencing kind of a different set of rules because of the nature of your work?
I would say because Meibao is a pharmaceutical company, but we also have our own kind of a hospital operating in China. So therefore, we actually have our companies actually are complying a kind of a procedure. Meanwhile, our hospital, which is in Kaifeng, China, is also undergo another kind of a hospital procedure on how to have people get back to work or how to actually have the day-to-day operation back to the daily basis.
Got it, got it. But the administrative teams are all basically, for the most part, back in the office.
Yep.
Got it, got it. Okay. What are you doing? And I know I want to talk a little bit about local policies that are affecting, what Maybao is doing, but I know, and we'll get into this, those are going to be really different depending on which office we're talking about. A lot of these policies are all regional. What is it that you're doing? Kind of just Maybao policies that are, just trying to make the employees feel more comfortable getting back to work.
I would say on our side, we took a couple of approach that, first of all, we actually partner with many non-for-profit organizations. The reason why, because as I said, our major work is in the medical field and in the hospital. And in addition, we run the China Burn Network, which is kind of like the hotlines. So regarding to like burn injury, et cetera. So what we do is we need to actually partner, or I would say collaborate with the non-profit organization that run in the medical field regarding to how we can get reach to all the doctors and how we coordinating to the doctors. And for example, one of the major, I would say, changes we made difference between a couple of months ago is when China having this coronavirus outbreak, one of the major steps they changed in the hospital is for a decent kind of a severe injury, they will accept patient. But normally, like they will do a first response assessment to the patient to make sure that if the patient can took the treatment back in their house or home, because they want to leave the hospital bed or like the resources enough for the coronavirus patient. So therefore, as us, we focus a lot on the emergent care. So therefore, most of our hospitals, I would say we have a network line about 60,000 hospitals in China. So they all follow the similar kind of procedures, but now is the time that to gradually actually bring accepting patient back for treatment and due to the reduce of the number of the coronavirus patients. So they start to have enough medical resource allocated to patient that aside from the coronavirus.
Okay, why don't we talk about some smaller things, some basic day-to-day things that any company, when they, again, hopefully, fingers crossed that in the Bay Area, at least March or May 1st, May 3rd is when we're actually out of our houses. What are some day-to-day things folks can do to make it easier for folks, for people to be back at work?
I think one of the interesting things is when we allow to actually have people back to work, the first thing we need to do is we actually coordinate with like the office building security team, because like the security team, they can perform additional kind of functions rather than providing protection or security base. So for example, like they will enclose a couple of the entrance and only leave one entrance open for people. So therefore, when people step into the building, they can do either a temperature check or they can actually have a certain kind of assessment and make sure that people are good to work. And second of all, they're using this, we're actually having the security guard working on control the influx of the people get back to work. For example, like the elevator capacities, etc. So they want to make sure that people are not in a condensed kind of a group and make sure they have a certain kind of a distance among each other.
Have you had to make adjustments to working time in order to do that? Have employees come in different shifts, adjust the whole 9 to 5 concept?
Yes, actually, we do make that kind of change because we have our business in 73 countries. So what we do is actually we have the actual China team. Usually we have the China team and also our international team working in the same building, in the same floor. But now since like due to the condensed requirement or like the people in densities, so we actually making 2 shifts. We're making our international team work actually in the nighttime, which is actually corresponding to other place at the daytime. So therefore, we're kind of like having 2 teams split out.
I mean, in a way, our team has been experiencing something very similar. We are based, we have our team in China, we have our team here in the Bay Area. We always find ourselves working at night for the most part anyway. So in some ways, has this actually been able to give you an excuse to kind of make things more efficient, to adjust those teams' times to work primarily when they really should be working?
I think what do we do is like, besides having the team shift, we're also creating kind of like a different communication group. Like usually like WeChat is pretty good tools. So we actually have a different kind of like a task force kind of a committees that form in the companies, which they updating each other, so everybody can stay on the same page. But in the meanwhile, when there's a different shift, they know what other people are doing. But by the major thing is we want them to all knowing that all of those adjustments are made based on to prevent a additional kind of an infection or reduce the risk for the employee.
Gotcha. So like, of all the adjustments made to this point, how do you feel, are there any of them you feel like this is just what we're going to do going forward, regardless of what happens with the recovery, with, you know, post-coronavirus environment? Are there any changes you made at this point where you feel like this is actually for the better and we're probably just going to do business this way now?
I would think that the thing is, because we're working in the burn and trauma industry, so therefore like the traditional way of like seeing patient, they're not being much different, except that right now telemedicine is a pretty like there's an opportunity for telemedicine to arise. And what's been going on, as I said, like we're trying to change our method of bringing like directing patient to the hospital by actually have a doctors assess the patient's condition before they reach to the hospital or making decision what kind of hospital they're going. So because of that, actually, it's time that we partner with Chinese Integrative Medicine Association. So to actually train the doctors knowing how to do the telemedicine for burns and trauma beforehand. So therefore we're knowing the best way of allocating the patients and also the resource.
Okay, gotcha. Now, before we run out of time here, we're almost up against 2:15 already. Amazing how fast this goes. Let's just talk a little bit about the local government policies. Let's start with Beijing, because your headquarters, most of your employees are based out of Beijing, right? Has there been anything the Beijing government, Beijing city has put into place that you felt was, you know, this has been helpful in helping, you know, our company bring our employees back, and you feel like is replicable, something that, you know, something that another region could adopt?
I think there are a couple of things we want to talk about. First of all is like the overall, I think, strategy that China took. I think for us, we should learn from it is what is the right way of distributing resources. The reason why I'm saying that, because when the coronavirus outbreak, the Chinese government actually came up with a strategy that all the resources have to distributed by the government instead of by individual organization. But the thing is, the resource or the contribution can be donated to the organization, but not distributed by the organization. So for example, that time we partner with the Chinese People Association with friendship of foreign countries to actually bring the resources to the Hubei Department of Foreign Affairs. But then the Department of Foreign Affairs actually bring the resources to the provincial government. So the government actually directing all those resources to different hospitals. Therefore, we want to make sure that we bring the thing to the right way. So that's how I think the government runs. But in the meantime, talk about how the local policies that bring incentive on how do we actually see from either in China or Shanghai, actually, they actually have a lot of similar kind of rules. First one I want to talk about is they want to make sure that the company do not do over layoff employees. So they actually came up with a program that when if the companies during the crisis time do not lay off employees, they will get a kind of like a reward kind of system of a 50% of a refund of their unemployment insurance, which is kind of like they're part of a social securities that the company pays. And in the meantime, what they do is in China, the government want to taking this opportunity to promoting online professional training. So during this crisis, whenever there is a online, kind of like if the company coordinating online professional trainings, the government will reimburse 95% of the cost. And because for us, when we're doing the training doctor, is part of the extensive continuing education credit for people in China. So therefore, actually, we took this platform and utilized it really well because, as I said, like I think China, what they're trying to do is they came out with a lot of strategies to make sure that the company are keep the employee intact. Meanwhile, making a gradual transitions back to work.
Got it. Okay. Well, and you said that was a national. That's a Beijing policy. The reimbursement for public or for employee training.
The reimburse actually are Shanghai policies.
Shanghai policies.
Is in Shanghai policies. So as I said, the interesting thing is because we have the Beijing, Shanghai, and Guangdong office, so we actually are trying to combine different kind of the incentive policies they're making.
Well, thank you, Kevin. I really appreciate it. We're again, we're almost on time here. And you mentioned earlier distribution as being kind of what was obviously pretty critical in the early response. And you've been funding some work at University of Chicago to help with address exactly that here in the U.S. So why don't we transition? We'll take this moment, transition to Abhilash. Abhilash, are you on?
Yeah.
Abhilash, I apologize.
No worries.
Let's take a minute and chat a little bit about the work you've been doing to help address some of that distribution issue, transitioning now away from kind of the Chinese policy and the corporate response. Let's take a minute to talk about what we can do to get ahead of this on our side. So why don't you do a quick self-introduction and tell us a little bit about what you're doing?
Sure. I run a center at the University of Chicago called the SHU Initiative on Science, Technology, and Global Development, as well as the Measuring the World Lab. And our goal is to use data, particularly big data sets, to inform public policy around the world. And one of the challenges with the COVID pandemic has been that data around testing obviously has been poor and siloed, but another challenge has been that data around hospital capacity and medical capacity in the US has also not been easily accessible to a lot of decision makers. So what we've been trying to do is to combine existing epidemiological models and aggregating administrative data on hospital capacity and collecting interesting new data sets that measures how effective social distancing has been and aggregating that to figure out how we can predict where surges are going to be high. And so our goal is to use these data sets to build tools that can be used by decision makers, be that donors or city officials, to figure out where the allocation of resources needs to be done and where the surges are actually going to be extreme.
So you've got a couple of visuals you can give us. We take a look
Absolutely,
at
yeah. So as I mentioned, I'm here speaking in my capacity as director of the Measuring the World Lab and the Kevin SHU Initiative. And the key question, and I bet a lot of the participants today have seen these headlines, has been, supply chains have been really messed up. And part of the reason why supply chains have been messed up is because we have really bungled collecting and presenting data on where resources are most needed. And so the two questions that we have been trying to answer is if you want to do rapid resource allocation during a pandemic, which is very rapidly evolving, the two data sets that you need a handle on is figuring out hospital capacity, not just at an aggregate state level, but at a county level, and also figuring out how successful social distancing has been, again, at a county level, partly because unlike other parts of the world, social distancing measures have been highly uneven in the United States. And so it's very important to figure out just where they have been successful and where they haven't been, because that really determines how, where you'd like to allocate your resources.
Yeah, those social distancing measures, though, are like pretty different depending on where in the country we are, right?
Yes, and I will actually come to that data set. So just to sort of preface how we, what we do, we basically collect hospital capacity and demographics data at the county level from existing administrative data. And at the county level, we can determine how successful social distancing has been by looking at cell phone data. So imagine your cell phone is pinging constantly, and you can take an aggregate number of cell phones and look at the average distance traveled between cell phones at the county level, and you can use that as a metric to figure out whether a particular county has actually complied well with social distancing or not.
Let's look at the map.
Yeah, absolutely. So let's see. All right. So this is an example of the kind of tool that we're building, and this is a map of hospital beds per 1,000 people at the county level, and the sort of yellow dots are the places where hospital bed capacity is actually pretty good, whereas the sort of darker patches are places where hospital capacity is pretty limited. But the really interesting thing is actually looking at social distancing, and you can see here, so social distancing on the scale here, just to give you some context, 1 means social distancing has been extremely successful, and 0 basically means that social distancing has not been successful. And as you can see, things don't look very good right now.
Yeah, no, there's not a lot of ones on this map. Actually,
yes, exactly. Yeah, I mean, you don't get ones at all, but you get like pretty, so San Francisco Bay Area, the San Francisco Bay Area is actually pretty good. New York, when you look at it, has been pretty good. Whereas if you look at parts of Texas, parts of Florida, they actually perform really poorly on the social distancing measure.
So if I'm a mayor or a governor or someone at the FDA, how do I use this to help me understand where where supplies that we've been buying? I know in the state's case, California Office of Emergency Services has been buying a lot of medical supplies, certainly over the last 2 weeks.
Right.
I mean, if knowing how few hospital beds there are in a given place is one thing, but then there's also a lot of behavior, and then there's if in Louisiana's case, as an example, went ahead with Mardi Gras, so major kind of events that will affect when somebody is going to get affected. Does that information come into play when if I open up this map and say, oh my God, this is red and there's no ICU beds?
Yes. So in fact, since you talk about ICU beds, actually that is the thing that really scares me. This is what it looks like. So this is 0 is basically no ICU beds per 1,000, and 1 is 1 ICU bed per 1,000. And this is one of the scariest maps that I have seen in the past weeks. And this, I think, is the more, and if I go back to my slides, if you sort of put them side by side, you kind of see that regions which have been performing poorly on social distancing are also regions which have very poor ICU capacity. So I think this is a message that really needs to be drilled into a number of city mayors and state level officials, just to sort of say that social distancing is a critical part of making sure that ICU capacities are not overwhelmed. And in a scenario where there is practically no ICU capacity in many counties in the United States, it's critical that we that we impose these social distancing measures now. And also, I don't want to spend a ton of time going into the weeds of how the modeling happens. The model accounts not just for social distancing, but when social distancing starts becoming effective. And another data set, which I'm not showing here, is basically dates, number of days after the epidemic starts, when social distancing measures get imposed. And in many of the states where ICU capacity is low, the measures have just been imposed in the last week, which means that we are already behind the curve in many ways. And so a tool like this, and we're trying to sort of figure out ways in which we can make this more live, so that public officials can play around and say, if I impose it 2 weeks back, or if I impose it a week from now, what kind of differences that makes to my surges.
Yeah, I was going to say, this seems like a lifespan to this information that's kind of like, we need it right now.
Yeah.
So, I mean, with that said, when is this going to be available to?
So the other challenge in working with data is that we need to make sure that all the data that we are putting out there is reliable. So we're basically making sure that all the data sets that we have collected, the administrative data set is of course pretty reliable, but we're running a few sanity checks on the social distancing data set. But they should be available on the website, COVID Global Policy Response.org, which we are launching, which should be live hopefully tomorrow. And this is an initiative with the Aspen Institute that we are coming up with. And so the data sets and these visualizations and tools will be available at this website. And I'll be sure to send the link to you if you want to put this circulated amongst the attendees.
So, we'll go one last question for you. So, I mean, we've been fielding a lot of donations from folks of medical supplies, primarily, sadly, no one's offered to donate a ventilator, at least through us yet. We're fingers crossed. And if anybody on the phone has extra money, let us know. We're happy to go buy ventilators with them. But with that said, if I look at this map, okay, it's good to know, where, ICU level critical, severe case response is going to be available. But what if I'm trying to donate a bunch of masks? Is this reflective of, that kind of need? Or is this really more of where, which place, where around the US is going to be prepared to deal with the really critical response, the severe conditions?
Right. So that's an interesting question because of two reasons. One is because of the CDC recommendation that everyone wear masks, and which kind of brings about a whole different resource allocation challenge. In the context of assigning masks to hospitals, my understanding is that a lot of hospitals in rural parts of the country don't seem to be as locked into the kind of supply chains that you might find in LA or San Francisco or New York. And this is where a lot of the social distancing measures have been poor, and you'll see a lot of spikes. So if you want us to think more proactively and think about where a ton of hospital masks will be required, I would suggest looking at parts of the rural Southeast where the surges are going to be really high. And if you look at hospital sort of financial data and capacity data, the hospitals there are just extremely poorly equipped. So figuring out, I mean, if you're sort of thinking about impact per dollar, figuring out ways in which that supply chains get fixed up, I think is really crucial, because it's likely that they don't have access to the kind of supply chains that, say, hospitals in California would have.
And I guess I did have one additional question. Sorry. Having access to an ICU is one thing. Having the personnel to use equipment, assuming it were delivered to that place, is yet another. I assume this map is just as reflective of staffing as it is of availability of equipment. So flooding a place with a bunch of stuff isn't necessary.
If you don't have the people, if you don't have the people, I'm sure again, like, these are the kind of maps that that the DoD and other federal agencies, I'm sure, have them. It's critical for public-facing officials who are making asks of the federal government to look at these maps too, so that they can go tell the federal government saying, hey, we need X number of people in our staff, and we're really short of it, or the fact that they're going to see this huge surge coming in the next couple of weeks, which they might just not be prepared for.
Gotcha. All right. Well, Abhilash, thanks so much for putting this out there. Could you put the website back up? Yeah, thank you. Yeah. Anybody's interested in checking out their work, knows anybody who could use it, please check it out.
And feel free to reach out to me. Yeah, thank you.
And yes, your contact info is right there. Kevin, thanks so much for answering some questions today. Looks like we don't have any submitted on the chat, so I guess we covered everything. Our next conversation, we're going to do something a little more statistically driven. Chat with another partner of the council at Des Anshira, just talk more about the growth of the economy following the end of Chinese New Year. Kevin, Abhilash, thanks so much, guys. And thanks everybody for joining us.
Thank you.